Welcome back to another edition to the Root to Rising podcast. This is a podcast that was created for women to share their stories, their journeys, for other women to hear, learn, and gain knowledge and experience to find their true purpose and happiness. Today I have another special guest with me, Allison, who's going to walk us through her career journey professionally and personally, and excited to have Allison on the show. Allison, welcome. Tell us a little bit about yourself.
Okay, so I own an integrative nutrition counseling practice and specialize in food sensitivities and gut health. So in my work, I'm really helping people to get to the root cause of their symptoms and how an integrative approach is different than conventional. For wellness tends to be reactive, and for an integrative approach, really doing a whole systems approach and uncovering what we can to figure out how systemically to help people feel better, as opposed to kind of, treating things with a prescription, which is very typical in a conventional approach.
How did you get into that? It's a very different way of looking at medicine and treating someone's body or even looking at things. I think people look at a symptom as very isolated, but usually it has to your point, more of a root cause to it. So how did you get into it, and what was kind of your trigger to start investigating and researching that side of medicine?
Well, I actually got into that because of my own issues with gut symptoms. Back when I was first working in the hospital setting, I was in my 20s. I was having a lot of digestive issues and and this is a very typical story that I've heard time and time again. It started with my own experience. Went to my gastroenterologist, had a bunch of testing done. Had my first colonoscopy at like age 25, which is pretty unusual. And
Mhm.
long story short on that was that they really didn't find anything. And I was pretty debilitated by regular symptoms. So that led to, in my professional life, becoming very interested in what we didn't learn to become a registered dietitian, you need to have uh, at least a bachelor's degree and pass a national exam. And the curriculum at that time, it might be different now, but was what I would call clinical, and it lent itself to a hospital position. That's where I started. And but it was after that time, because this was later. I didn't probably pursue that until at least 10 years after that. But my symptoms becoming so problematic and needing to do continuing education as a dietitian anyway. In my professional groups that I was in, this integrative path kind of revealed itself, and I was very interested in pursuing it, and really I was my own first client in my business, being able to eliminate the symptoms I was having. And that's really what I do to this day with clients.
So if it's not part of, a standard curriculum or wasn't in the school system or in, the colleges or the exams, how did you find that information, or how did you know where to look to not find the information that you were getting in the clinical setting? Where did you go and how did you research that?
Uh, it was part of a Facebook group, a professional Facebook group with other dietitians. And it was just something that, reading through posts, somebody had posted about. This was specifically related to where I first started in integrative, which is food sensitivity testing.
Mhm.
Mediator release testing is a very specialized food sensitivity test. Mm, And that was something I needed continuing education hours for my licensure anyway. I thought, well, at the very least, I'll get my continuing ed, and, who knows what will come of that. But that really was the catalyst for pursuing advanced study that took years to go through, in integrative more broadly than just food sensitivity testing, and led to further strengthening my knowledge and experience in gut health. So since they are tied
Interesting. So
together.
you were your first patient. So maybe walk through, what you heard from physicians and then what you did to help diagnose or to understand what was happening or the root cause with.
It's very typical. And I see that, like I said, I see this to this day working with people who have been, it's often a gastroenterologist, maybe a primary or other specialty, but they're trying to rule out or in specific conditions that they will order testing to accomplish that, to rule those things in and out. With digestive symptoms, there are so many things potentially contributing to those symptoms that the majority of people that I work with, they've spent a lot of time. So you get told that your lab work is normal, you get told that your colonoscopy is normal, that those are kind of the two main things, lab work and colonoscopies for gastroenterologists. That's kind of the initial, let's make sure there's not something very significant happening here. But people, I've learned, unfortunately, they get labeled with an IBS diagnosis, which is
Mm-hmm.
irritable bowel syndrome, is really a diagnosis of exclusion. We can't find anything else wrong with you. It's not really helpful. And it's descriptive. It's irritable bowel is, what it sounds like. Your gut is irritated
Mm-hmm.
and you're having symptoms. And so many people, whether they have an IBS diagnosis technically or not, they don't feel very well with their gut health, and but they get told that everything's normal and or prescribed a medication that oftentimes has notable side effects that are, potentially maybe even worse than the symptom they're having at baseline.
So then what if if you can share kind of what you found out about yourself, how you found out about it, and what you did to discover the actual root cause of what you were dealing with. And the reason I ask that is just to hope that even the questions you asked yourself, right, is something where people spend a little bit more time digging deeper or how they do that.
Right. So for me, where I first started was with food sensitivity mediator release testing, this special type of food sensitivity testing. And it's a way to guide an anti-inflammatory personalized diet, which is going to it's going to identify triggers. So there were things that I was eating very regularly that were directly contributing, if not outright causing the symptoms I was having.
Mm.
And this is not something that it was not on my radar before I went in to learn about it professionally, but I thought, well, I'm actually a really good candidate on paper for this type of approach. So let me just see how this goes. And
Yep.
that's really how that started. This particular panel tests for 176 different foods and chemicals, and you use the
Wow.
reactivity. So it's measuring reactivity, immune system inflammatory response to those foods and chemicals. And you use that data to go through a couple months worth of an elimination diet, which is removing things temporarily, seeing how your body responds, and then reintroducing them later. And that was really what changed my life. I mean, I was, as I said, I was
Hmm.
kind of debilitated with things like which I typically see, just abdominal pain and cramping and irregularity with my digestion and things that if I hadn't done that test, I don't know what would be happening today, honestly. I feel very thankful that I think about that a lot, the fact that I just happened to be a dietitian and I just happened to come across this technology and this approach, and that certainly was very motivating for me professionally because I really wanted to help other people, because I knew that there were other people in that same boat that weren't getting the answers that they needed to get better.
Yeah. So what's the name of the test again that you called it? What was the
It's called
panel?
the MRT, mediator release
Mm.
test, and the test itself is the technology that's used, but really it is a tool for an elimination diet. There's if one has heard of a food sensitivity test, it's probably not MRT. It's not as well known. There's one lab in the country in Florida, Oxford,
Wow.
that runs this test. So most people have heard of IgG testing, which is not effective. It is testing for what your immune system recognizes. It's not measuring any inflammation of any kind. So there are practitioners like myself that have been trained in using the test to guide people through the elimination diet process.
So if this test is so helpful and it helps with so many different factors than the IgG test, why isn't the MRT test more widely used?
Well, I think the short answer is because it's r- it's relatively new, but
Okay.
like relatively new being developed around 2010, I believe. So it's not
Okay.
really new. Um, and I think the other piece is that IgG testing. I can't really speak to when that technology was developed, but in contrast to something like a prescription that has a lot of funding behind marketing and studies and things like that, that doesn't exist for something like MRT. So, and I think because it's something that dietitians use, and dietitians and nutritionists are still, they're they're not quite as mainstream in the healthcare system.
Yep.
A lot of people still they've never worked with a dietitian. Their physician may not, more likely than not, doesn't partner with one, and a dietitian is who would be more likely to be aware of this kind of test.
Yep. And I'm gonna kind of go on my perspective of why this isn't as popular. I do think, the US population is looking for that quick fix to fix something, and they've been trained over time. Like you go to a doctor and you commented on it, physicians, just like you were clinically trained to rule things out. I mean, they're seeing thousands and thousands of patients with so many different symptoms. They were trained to rule it out versus looking at things holistically in terms of what could be going on with the entire body. And we have specialists that focus in certain areas for that reason to become experts with that area. So it's almost a flip of the script, and how you talk about holistic care is physicians in that specialty, they're looking to treat, what they can rule out and what that symptom is, and either don't have the time or the financial reimbursement or the knowledge even to say, here's holistically what you could be doing to investigate what's happening in your body. As we all know, our body works as an ecosystem. But I would say, you're obviously very educated as a clinician, and those in healthcare understand that and probably have a different perspective. But your day to day common person that's just eating whatever or living life, like they just want that symptom in that moment to go away. And maybe they don't understand that it's a holistic ecosystem and how they should be looking at things from a root cause perspective. So it might be a shift in how we, thank goodness you do what you do, but shifting and teaching the common population on how to look at their body. And then you go into, GLP-1s that have been created. Hey, I've been overweight my whole life. Now I can, have an injection and help me lose weight versus figuring out holistically what's going on in my body and taking care of my body from what I'm eating from a fitness perspective. And now they have another quick fix to solve for that problem. So just my perspective, I think it is a mindset shift. And then financial and reimbursement usually follow, what the easy button is for the population today. So with that all being said, tell us about how you treat your patients today, and maybe when you have a client, what's step one? What do they need to do? What do you do with them? And what do those conversations look like to help them understand what's going on, from a root cause perspective for them?
Sure. So when I work with clients, we're really starting off with a lot of data collection. Just any healthcare provider, you're going to fill out those initial forms. And my forms are pretty comprehensive to be able, because the more information I have, the more I can help someone. And that's what I mean by diet is certainly one of the main and most important things that we're talking about. But it's also gathering information about lifestyle, how this person lives and what their sleep patterns look like, what their stress looks like, and where they spend their time, how they work. Those, all of these things really are important to to be able to assess where someone's baseline is. And depending on what they're looking to address, not everybody that I work with does food sensitivity testings. I do also use stool testing to look at the gut microbiome and there are protocols that we do, but from the beginning, we're really just starting out with what are the things that you're looking to address? What are the things you're looking to solve for? And we will start with lifestyle shifts and making tweaks to move towards where we're trying to be, ending up at. But I think what you spoke to is for a lot of people where this approach is kind of revolutionary to them, because nobody that they've worked with, no healthcare provider, I hear this all the time, no healthcare provider has ever spent this amount of time.
Yeah.
Because when I'm working with people, we're ideally going to be in a process together for a good 3 months at least, because it takes time. It takes time to
Yep.
not only uncover what we're trying to address, but also to make changes to help people feel better. It isn't something that happens instantaneously. It's gradual over time, and as it should be, because otherwise it would be overwhelming to try to overhaul your whole life and a visitor too. Even it is the way that I work with people, and as I say, that they are always so thrilled to have this. It's very collaborative. I'm here to guide clearly and educate, but I'm also, in this process with each client and very available throughout the process too. So that's something that people aren't used to. Usually when you go to see your doctor, for example, you might get a few minutes and they're out the door and on to the next patient. And, it's like, oh, I didn't even get to talk about all the things I wanted to
Right.
talk about. What about this? What about that? And it's a very deep dive kind of approach. So people really respond
No,
to that.
agreed. And I think people, it's also prioritizing their own bodies and care, right? And it's not going to be fixed in a doctor's visit. So using other, folks within their holistic healthcare journey to help compensate for some of those discussions. So today you have a business. What's the name of your business, Allison?
Customized nutrition.
Okay, customized nutrition. So you recently went independent, correct, in terms of starting your own business? I'm going to flip a little bit. So if you go back, tell us maybe a little bit of, you were on the clinical side. You recently, talk about what you did. Believe you left to venture out and to create this independent business for yourself. So maybe for those that are contemplating to do something different or go independently because they're either want to do something more, they're challenged with their current environment. Maybe talk us through what you were doing and what really gave you the courage or the confidence to change it and to go independent.
Yeah. So my clinical position that I was in, that was many years ago by now. So I've been a dietitian for over 25 years at this point, and my clinical position was right out of getting that degree. And what my professional path has looked like has been working the hospital position. And then I was really at home with my two kids almost exclusively as a stay-at-home mom for almost a decade. And I did form customized nutrition technically to be able to work legally with clients back in the 2000s. So it's been some time, but the way that I'm practicing currently, that was actually in 2018, and at the time was a part-time endeavor, just trying to educate myself on how to even run a business, be an entrepreneur. That's not something I learned in school for my nutrition degree. So that was a huge learning curve. And at the time, things looked different personally for me. So I was married at that time, and it was, kind of figuring out the website and the leads and the marketing and where to get the clients, how to get the clients, that kind of thing. And I did that for several years, but what happened most recently, I think you're referring to, is about a year ago, I took on a full-time position and really put my practice on the back burner. So I worked for a startup for just about a year that seemed really well aligned with the way that I'm used to practicing, in terms of the company I worked for partnered with gastroenterology practices to provide nutrition counseling, lifestyle counseling to the patients there. So what I learned in that time is that, and I'm used to working virtually, that's how my practice was, but this was, you know, a very traditional 40-hour week, 6, 7 people, hour-long sessions a day, 5 days a week, that for a year. I learned that that amount of virtual work, it wasn't a good fit for me. And also I realized this isn't the place for me.
Mm.
It was, I was helping people and that felt good, but it became clear to me pretty early on that this is not the good fit for me. I need to get back to um, really focusing on my practice. And um, and again, personally, at the time, going through my divorce and needing to really have that consistency with my work and my income and things, it felt like it was the step that I needed to take at that time. And I don't regret having done that, but certainly, because professionally, my role is always helping my clients advocate for themselves with their providers. This was something that I need to walk the walk in a different way, but when you need to do something differently for yourself, you gotta move. So that's why I ended up resigning from that position and deciding to do a hybrid where I'm doing virtual practice, but also what I'm working on now is trying to get partnerships with local providers so that I'm not doing virtual 100% of the time. So.
That's awesome. So I'm going to go back to a comment. You said you wanted to, go back to be running your own practice. So you went to be an entrepreneur, but you didn't have that know-how, because obviously going to school to be a clinical nutritionist or dietitian is very different. So maybe talk through how you taught yourself to be an entrepreneur, mixing the business side with that clinical and science side. What did you do? What steps did you take?
Again, I just leaned on my dietitian network, because there are a lot of dietitians that go into private practice. But again, because we don't learn that in the degree directly, there's these dietitians are in the position where I either have to learn from somebody else or teach myself how to build a
Yep.
website, or hire somebody, or the just setting up the business legally and technically. How do I even do that? What is the best way to do the marketing? So I leaned heavily on my network, and there were some courses and some coaches and programs and things that I did. There's a lot of dietitians that their business now is teaching other dietitians how to run a business. So
Yeah.
because they were figuring it out on the fly, and I was like, well, okay, I did all this work to figure this out. Other dietitians in private practice, they're not going to know how to do this either without accessing this information. So I've certainly been in that space for the last several years, honestly, little by little, just kind of building upon.
Yeah, so in previous episodes, I always talk about, it's funny how it always comes back to your network. I mean, every conversation I have, even if it's with like someone that just graduated college versus an experienced professional versus yourself, wanting to be an entrepreneur, it's always goes back to the people that you know in your network, and leaning on people to gain that knowledge and experience. And so I can't stress enough, to the listeners, is build your network early and often, and keep your network connections, make that a priority to keep that consistent, because you can lean on them in so many different ways, no matter what that is. So as you kind of look to where your path is headed now, you have your own business, you make it sound very matter of the fact. Like, yeah, I just went back and started, my own and took the risk. Many women, are in your situation, especially recently divorced, having to prioritize different things. You took the risk to be an entrepreneur and to go back to practice independently. So, what is there something in a time and a place that you remember that was that trigger to say, I want to do this? Was it over time that it just built and built and built in your experience, being at that startup? Like, if you're talking to someone today to educate them, if they're toggling between doing something different or maybe going from wanting to branch out from their company to be an independent or an entrepreneur, what advice would you give them in addition to what was like your pivot point that put you over the edge to take that leap?
I think there were a couple because I've kind of done it in fits and starts depending on what was going on, pre-divorce, post-divorce and things. And I think what the common thread for me was that I'd done enough work with people over these last several years in my practice that I feel very, very confident about the way in which I help people. I may not feel confident all the time about the inner workings of running the business itself, but there was like that thought, there's no reason why I shouldn't be doing this in the way that I am capable or have the ability to do, because in a traditional dietetics position, you're either a clinician or you're a manager in a hospital setting, in a healthcare setting. There's not there's like a ceiling there as far as how much you can
Yep.
achieve, and in private practice
Yep.
that's 100% not true. So it was I think, however many years ago, and then being in the startup position, it was like, I know what outcomes I achieve with my clients. I know the experiences that they have and how life-changing it is for them to go through that process. So I feel confident in that. And again, I think because I'm all for promoting for my clients that they advocate, you have to be your own best advocate. No one's going to do that for you. You have to do that for yourself. And I'm sure there was more than one time that I was having a crazy back-to-back day. At the startup, the schedule was really, really intense in terms of not getting breaks during many breaks during the day. There was probably, I can't remember a specific day, but there were many that I felt like that, like, I don't need to be doing this. I have too
Yeah.
much experience. I have too much skill.
Yep.
This is not where I need to be. And that's scary, obviously, to think about the unknown and what could be, but it's like, no one's going to do it for you.
Yeah. Where do you think, and I heard a little bit, but where did you get the confidence from? And again, like, so it sounded like you were ready to make that transition, but a lot of people stay in the role or the company they're in just because they feel like it's too much of a risk. They don't have the confidence. Maybe they know the know-how, but they're still scared. Did your confidence come from because you had experience and you knew you were impacting people's lives and that carried through? Like, what gives you the confidence? And the reason I'm really honing in on that is because specifically these college graduates, right, that are either in their first job or finding a job, there's a lack of confidence in themselves. And so I'm trying to pull out of you to see what you could teach them to create the confidence, find the confidence or the courage to really do something different and take that leap. So where do you think you got the confidence from?
It was probably, well, I think, as you say, I do think it's because the way that I am, it's my nature to struggle to make a move unless I'm feeling like, okay, I really know what I'm doing here.
Mm.
Now, and so the piece that really matters is, if I'm going to try to be helping people, I have to feel confident that the way I work with people and the work that I do is going to be helpful. I I've had 2 decades plus of experience working with people, and more specifically in the space of food sensitivities, gut health, and I've been in those sessions over and over again. So that is really what was helpful for me. Now, the other piece about all the business related things, I can't say that I've had a great amount of confidence in that. I think being in a network where you have other women, dietitians are mostly women. So it's empowering to be in that space, but to be talking about the things that they're doing, why to move their business forward, right? And my thought is like, well, there's no reason that I shouldn't be or couldn't be doing those things too. Why not me?
Mm,
Because it is easy to stay where you are out of fear. And I relate to that 100%. Uh, but there is also that, I've heard this a lot too, fake it till you make it kind of
yep.
men, especially who, the
Yep.
statistic about men going into interviews, or I'm sorry, to applying for positions that they're not remotely qualified for. And they get those positions, and it's like, why aren't women doing the same thing? And kind of similar, like, I feel like it's similar to that. Like, I know that what, my product is, if you, so to speak, is solid. I've seen the results that people get over and over again. So there's no reason I shouldn't be,
Yeah.
working in that way and doing my business in that way to be able to help more people.
Yeah.
But frankly, yeah, I think the phase of life that I'm in, maybe it's easier said than done, because when you get to a certain age, I think as women, you just don't care as much about what other people think.
How can we take that mentality and make it go back 20 years in time to give it to our younger versions of ourselves, right? How do we I agree with you 100%. Like, and that's kind of one of the main reasons I wanted to do this podcast is like all the knowledge that we have, let's call it in our 40s, 50s, if we had that and we knew that, in our 20s, gosh, what a difference and what an impact that would make in the decisions we made. And I do think it's correlated to your other comment, like why do men show up at no matter what age, 25 or 55, and they assume the confidence. They don't know any better. Like they're just confident. But then women, we're always questioning ourselves. Are we confident enough? Do we have everything? Do we have all the boxes checked to take that leap and to have that confidence? And I'm, just trying the reason I go there on those questions is, gosh, we don't have to have all the checklists completed. We don't have to have all the answers to the questions. If you have the motivation and you have the passion and you have somewhat of the knowledge, take the leap. And who cares if we fail, and if we fail, we'll pick up and we'll fix it and we'll try something different or we'll try again, right? So it's always a circle that no matter what conversation I have with whatever woman, it comes back to that. So just personally, I appreciate you sharing the confidence story. If you could go back to your 20-ish, whatever, and tell yourself something different that you know now that you wish you knew then, that would make an impact on the decisions you make along the way that would have a different outcome in a positive way, what would you tell yourself? And then I'm trying to correlate that to, hopefully those younger women that are listening to the podcast.
I think I would have just made the moves to, open the practice, start the practice. I would have done it a lot sooner. I definitely was in oh, I can't do that kind of mindset at that time. And granted, my kids were younger, so I think I was probably struggling, or I think I assumed I would struggle with how to balance that. And But I would have started sooner. I would have started sooner, and I definitely didn't have it's easy to say, like, looking back, but I didn't have all those clients under my belt that I have now to be able to draw from and say, "Okay, you're, um, y y the confidence in just that my abilities to help people and the outcomes that they get." I guess I wouldn't have had that, so that's easy to say in hindsight, but, um I would have started sooner. Yeah. Don't wait, you know? I
What are we
if you're
waiting for,
What are we
right?
waiting for? Yeah. If you're thinking about it, Yeah,
Yep.
as you say, because the fear of failure, really, it when that prevents you from making the strides, taking the steps, then you are in some sense kind of failing yourself because you're not even giving
Yep.
yourself a chance. And it's worse to not make the steps at all, take the steps at all. As you said, you can always pivot and figure something out.
We almost like verbally and thoughtfully think ourselves through the failure. Like we're saying to ourselves, "Oh, this isn't going to work." We haven't even tried it yet, like in real
Right,
world, right? We've already just talked ourselves out of it and it's failed without even trying it, right? So our thoughtfulness is often a compliment, to women and how analytical and thoughtful we are and critical thinkers. But on the other side, sometimes do we overthink or critically think too much that then impedes us on making those decisions that could have given us new opportunities or a fresh set of eyes. And we don't have to always have every plan figured out. It's sometimes just taking that leap of faith as you commented on.
for sure.
So kind of to round out the last question, bringing it back to, your comment on personal advocacy, as your own patient or female or person in terms of having a holistic perspective of care to your body, what advice would you give someone? And they don't necessarily have to be struggling with anything, gut health or anything right now, but just your perspective as what you've been through in your healthcare journey. What suggestions would you give someone to be their own personal advocate as they look at their holistic care for themselves?
Yeah, I think I'm so passionate about tr- trying to empower people because um in a conventional medical system, you go in, you say, you might be thinking about something that you want to address, or you go in to see a provider, and a lot of times you're not getting the response that you're looking for, and we I think are still in that mindset. Well, the doctor said, and, I always want to remind people, like, it is still your choice. Yes, the doctor might be saying, "Oh, I think you should take this medication." The number of people that I work with that they're actively taking medication that they tell me, "I don't want to take this." And yes, I'm not trying to contradict medical
Yep,
uh I'm not trying to contradict something that maybe the person legitimately needs to take for their
yep,
well-being, but a lot of time people are taking things. I don't know why I'm taking this. It makes me feel like crap, this, that, and the other. Or they lament to me about the things that they wish were different, and I need to remind them that you are the person that's in charge of what this looks like, and please ask the questions and question. And if you're not getting the response that you're looking for, if you're not getting the care that you need, please go elsewhere, get a second opinion, get a
right,
third opinion, find a new doctor. Don't, have the discussion about the medication. Explain why you don't want to take it. And also, it's your
yep,
choice. Just because it's prescribed doesn't mean you're required to take it, unless, obviously, of course,
yep,
this is something very more serious. But that's not the experience that I have with so many people that I work with. They just
yep,
they don't speak up for themselves.
yep,
And yeah, I really always want to have that discussion, to help people know that they can and that they
yep.
should, because no one else is going
That's
to do it
awesome.
for them.
Yeah, and physicians are human, right? So yes, they went to school, they learned the science, and I agree with you. There's oftentimes a disease that has a direct correlation to a medication where it's life-saving, it'll help your disease. But in terms of being your own self-advocate, if you can't get it from your physician because there is limited time, there are other ways to get information, through other types of healthcare providers or support that you can gain more knowledge. So I do see a shift happening. I think the baby boomer age was very reliant, whatever a physician said, because of probably social media and the limitations of access to knowledge, that was limited. So they had to believe it. And it was really hard to go in like a clinical journal and find a certain study and research about a journal article. Now that we have access to that electronically within social media, you can research it on your own. To your point though, like find the science, right? Don't look at sometimes the subjective opinions aren't right, but gain the facts like you have, gain the appropriate testing. And it's not a quick answer. It's a journey to figure out, how to keep your body, cared for holistically and have that right balance. So no, I agree. I tell my parents all the time, it's like, yes, your doctor said that, but let's just look at some articles. Let's look at some factual information and make sure it checks out and get other opinions. So I appreciate your comments on that. So with that, Allison, I've enjoyed our conversation. It was definitely a mix of a little bit of professional, a little bit of holistic healthcare, and appreciate your personal journey throughout this too. So thanks to Allison for joining us. As a reminder, this is Root to Rising podcast, where Allison, like others, have shared their stories for you all to hear and learn her experience to hopefully provide information to help your purpose and your happiness. So this is Christine Hummel. Talk to you next episode.